Hi guys, I hope you're well and keeping safe. Welcome back on my YouTube channel. If you're new here, my name is Mary. I'm a nurse and I work in Kenya. In today's video guys, I just wanted to educate new mothers in town. Congratulations. And I wanted to tell you guys some of the things that you might notice on your newborn babies and know that it's very normal. It happens to a good percentage of babies. So you don't need to worry. Although sometimes if you're a new mom, anything worries you, including if the baby turns, you are worried. If the baby doesn't, you feel like the baby is not breathing. It's very common in new mothers, and you don't need to worry. That's just a stage and you will just get used to these angels. So I just wanted guys to tell you about some of these new things that you need to learn and need to know that it's very normal when it happens to your newborn babies. First and foremost, newborns tend to sneeze very often. Sneezing and nasal blockage tends to happen very frequently because remember, these are just babies that are adapting to new environment. Anything irritates them, including dust and any scented perfumes, soaps, even oils. That's why we advise new mothers to avoid these scented products, because we don't want these babies to get a frequent nasal blockage. If you can prevent that, it will really be helpful. But also remember, it's normal and very common. And if the nasal blockage is too frequent, you need to talk to your pediatrician. We have nasal drops that we normally put in the nostrils that helps to relieve these babies. Another thing that tends to be too frequent to notice is they pass meconium or the first stool very oftenly. So you don't need to worry. Actually, we get worried as medics, nurses, pediatrician and doctors. We get worried if the baby doesn't pass the first stool for the first 48 hours. It is important to monitor baby passing frequent urine and at least wetting the diaper or passing urine 4 times in 24 hours. It's very important to monitor that, because passing that first meconium helps relieve the baby, and we notice that also that one helps to prevent jaundice and other complications. So passing frequent stools, loose stools, it's important. It's very normal. You don't need to worry. What you need to get worried is when the baby does not pass stool or urine for the first 48 hours. Another thing is yellowish of the skin, or sometimes you can notice that in the eyes or this white part of the eyes. How do we call it? On the conjunctiva, the sclera, you will notice yellowish of the eyes and the skin. That's what we call jaundice in medical term, and sometimes it can be managed at home if it's mild, or if we check the levels, or if the pediatrician check the level and it's too high, we might need phototherapy. So with the advice of your pediatrician or a neonatologist, you just need to observe this baby, and if you notice it's getting worse, just liaise with your pediatrician. Sometimes we may need admission in newborn unit for phototherapy. Otherwise, if it's mild, we just manage it at home. Frequent breastfeeding, take plenty of water, and make sure you put or you bask your baby on the sun early in the morning or later in the evening. It helps also your baby. Another thing that's very frequent or very often in newborns is frequent choking. And as new mothers, we really need to be very careful when taking or when handling our babies, because this can be a medical emergency. Choking can be a medical emergency in infants. So we need to observe these babies. Just lie your baby on the back, head on the side. Always the head of your baby should be on the side, so that in case of secretions, the baby can be able at least to prevent the choking. But it's also important that you burp your baby frequently to avoid the colic pain, to avoid the choking episodes and secretions coming back to the throat. Remember, it's also very common. Choking is very common because babies are not used to swallowing. They're just, even the first few days breastfeeding sometimes becomes hard because babies are not used to swallowing. Another thing that's very often seen in infants or newborn is frequent choking, mostly with saliva or maybe breast milk or formula milk. And we need to be very, very careful, mothers, especially the new mothers. You need to make sure that you put your infant in the correct position. Mostly for the infant or newborns, we put them on the back. They lie on the back, but the head should always be on the side, either the right side or the left side. By doing that, we make sure that the secretions come out whenever they choke. So one thing that you need to know, choking can be a medical emergency in newborns, and we need to be very, very keen. When you notice your baby is choking, please don't scream. Make sure the head, just do one thing. Put the baby's head on the side, or at least the head to be lower. Just slide the baby's head to be lower so that when the saliva comes up, it can be able to come out of the mouth. And remember, it's very often, or it's noted in most of the babies, because they are not used to this swallowing, especially when the saliva is in the mouth. They don't have the instincts to tell them, I need to swallow or spit out this saliva. So sometimes actually it gets very worse, and it can be a medical emergency. So don't worry, medically, this saliva, when it's too, or the secretions, when it's too much, the doctors, we can do the suctioning, or if the suctioning doesn't work, sometimes they can do lavage. So, but you have to know that it normally happens to newborns, and we just need to be extra cautious when taking care. Positioning is very important at this time. Frequent burping, burp the baby so that we also avoid gas or colic pains. If the baby breastfeed, or if you have fed the baby with formula, make sure you burp the baby frequently, okay? After burping the baby frequently, you also check on positioning, and I've said the best position in newborn, lie the baby on the back, head on the side, either right or left, okay? Another thing that happens or that is noted in newborn is another thing is noted, guys. I work in maternity or labor ward. I'm telling you, sometimes mothers, especially new mothers, get worried about little things. You know, a patient can call you to ask you if their baby is breathing. A patient can call you to ask you if their baby is, you know, sometimes they have that small sound that when they breathe, they're trying to wheeze, or when the baby, sometimes they are smiling or while sleeping, or crying or frowning. Those are the things that some of the new mothers get really worried. They wonder if their baby is doing okay. I'm telling you, everything is fine with your baby. And one of the questions that I see mothers ask when the navel or the umbilicus gets dark, they get worried, maybe it's getting infection. No, you should not worry. That's a normal healing process of the navel. It should shrink and be dark. The navel or the umbilicus of your baby should be dark and shrink, and as the time goes by, within 1 or 2 weeks, it should fall off by its own. So remember, it's painless. Some of these mothers even are very afraid of touching that umbilicus. You should not be afraid. It's painless, believe me. And as the time goes by, it will be dark, it will start to shrink, and it will fall off on itself. We educate mothers on how to take care of this navel, and sometimes we put chlorhexidine or some cream to just help prevent infection and just to speed up the healing process, okay? So you don't need to worry about the navel. Just put it, or keep the navel or the umbilicus clean and dry. Make sure anytime you touch it, your hands are clean. Make sure when you're changing your baby's diaper, it's below you fold it under the navel, and by that you are preventing infections. Another thing that really worry patients or most mothers, especially new mothers in this case, is the navel or the umbilicus of their babies. Remember, the umbilicus will get dark, will change color to darken, and when it starts darkening, you don't need to worry. That's the normal healing process, okay? It will darken and shrink, reduce in size, and then fall off on its own. maybe within 1 or 2 weeks. Okay, so you don't need to worry about that. Just leave it on its own. Depending on the pediatrician's advice, you may need to have a cream or a drop called chlorhexidine. It's just in droplets or sometimes in cream. You just apply there once a day. Or if the pediatrician does not recommend that, sometimes you just use water and hygiene. When you touch there, you make sure your hands are very clean. You have washed your hands with soap, and when you change your baby's diaper, it should be below the umbilicus. So hygiene is very, very important. The umbilicus should always remain clean and dry. Even after washing your baby, make sure you wipe it with a clean cloth and just leave it that way. Expose it on air, it will just heal on its own. Okay, yeah. Another thing actually that mothers get worried, and it's very overwhelming, I'm telling you, no one tells you this when you are pregnant. No one tells you this during baby showers. Babies can really irritate you at night. They cry a lot. You ask yourself many questions. You start wondering if you are failing as a mother. You are not failing. It's very normal to most of the babies. You will find most of the babies, they get so upset, fussy at night. They don't sleep. You try to breastfeed them. They sleep 1 hour. They are up. It's a very normal journey, and we need to cope up with it for the first few months, especially first 3 months to 6 months. It's very common. So just make sure you adapt with the schedule of your baby. Most of the babies will sleep during the day, and at night you are doing night shift literally. Just be prepared for it. So sometimes it can be colic, that from the first few months it can be colic. And another thing is that you need to change or to check your baby's diaper frequently. Anything will make your baby uncomfortable. If the diaper is full, if it's very hot or if it's very cold, it will make your baby uncomfortable. Or if the baby is unwell, check the baby's temperature. Just make sure the baby is comfortable. Change the baby's diaper frequently. Look at the weather. How is the weather? Is it too cold? Is it too hot? You can expose this baby for a few minutes, or even you can cuddle your baby with extra blankets if it's very cold. And it's very, very normal. I'm insisting. I'm telling you, you will cry most of the times at night because you are tired, you are overwhelmed, the baby's crying, you don't know what to do. Do what you can as a mother, leave the rest. I don't know, but also support is important. If you have a spouse or someone who can come and help in, it's very important so that you can also get some rest. But I'm telling you, it's very, very common. Okay, so yeah, those are just few things that I really wanted to summarize for you guys, and I hope you have learned something from my video. If you have, please like this video, share with your friends, and please don't forget to subscribe. Leave a comment, let me know what you think, and I hope you get a reason to stay. On my next video, I'll be telling you on danger signs. When you see this on your child, please run to hospital, and I'll be sharing that on my next video. So stay tuned, please subscribe, and remember to comment. Let me know what you think about the video. Thank you guys for watching. As always, I love you so much. Thank you for your support up to this time, and I hope to see you again in my next video. Bye. I love you guys.